Hello. My name is Victor Emmanuel Mejia, and in today's video, I will talk about music and art therapists. The questions to answer in this exposition are: what is art therapy and how does it help people? The same goes to music therapy. The third question is: what kinds of medical illnesses, disorders, or problems could benefit from art and music therapy? And the fourth one is three on run: how does a person become an art or music therapist? What kind of experience or personality type is needed? And if would I make a good art or music therapist? Well, let's begin. What is art therapy? Well, art therapy is a field within mental health that enhances the well-being of individuals, families, and communities by combining creative expression through art, psychological principles, and personal experiences within a therapeutical setting. In other words, art therapy uses creative art making and psychological approaches to support mental and emotional well-being. But how does art therapy help people actually? Well, it reduces stress and anxiety because engaging in art making activities can lower cortisol levels, promoting relaxation and mindfulness. This can help more if you are a moody person. It also enhances emotional expression because art provides a nonverbal outlet for expressing complex emotions, aiding in emotional release and understanding. It improves self-esteem and self-awareness because creating art can boost confidence and help individuals gain insights into their thoughts and behaviors. And finally, it supports cognitive function and focus because art therapy can stimulate brain function, improving focus and cognitive abilities, which is beneficial for individuals with dementia or cognitive impairments. Well, then we go to what is music therapy? Well, music therapy is the use of music and elemental elements of music, like sound, rhythm, and harmony, to help people feel better, relax, or improve their quality of life. A music therapist talks to you to learn more about you, your needs, music preferences, and experiences, and designs each session specifically for you. But how does it actually help people? Well, it helps with emotional healing because music can reduce stress, anxiety, and the symptoms of depressed people by triggering the release of feel-good chemicals like dopamine and serotonin in the brain. It can help with cognitive improvement. For people with conditions like dementia or brain injuries, music therapy can improve memory, attention, and communication skills. It also can help with physical rehabilitation because rhythm and movement in music can support motor skills recovery, helping patients with strokes or physical disabilities regain coordination and movement. And finally, it helps with pain management because listening to or creating music can distract from pain and lower perceived pain levels. And what people can find particularly helpful is that music therapy can help individuals navigate their feelings, offering a nonverbal outlet for expression. Well, we continue to the third question, that is, what kinds of medical illnesses, disorders, or problems could benefit from art and music therapy? What art and music therapy can do is amazing, of course. Those types of therapies can benefit a wide range of medical illnesses, disorders, and problems, including mental health conditions like anxiety, depression, and PTSD, as well as physical conditions like cancer, stroke, and neurological disorders like Alzheimer's. Also, they can be helpful for developmental disabilities, sensory impairments, and even physical pain management, as I said before on the previous slide. And the fourth and last question, or well, three in one question. How does a person become an art or music therapist? Well, to become a certified art or music therapist, you usually need a master's degree in the respective field, along with hands-on clinical training and passing a national certification exam. Um, to be an art therapist or music therapist, you must be creative and have a passion for helping others. You also need excellent listening and communication skills, patience, and an interest in human behavior. And then, what kind of experience or personality type is needed? Well, music and art therapists tend to be predominantly artistic, of course, i- artistic individuals, meaning that they are creative and original and work well in a setting that allows them for self-expression. Also, they tend to be imaginative, passionate, and social, meaning that they are mostly extroverts. And the last question is if would I make a good art or music therapist? My answer is no, because I consider myself as an introvert, meaning that I am reserved, quiet, and I am passionate, but not in the area of psychology, arts, or music in general. I'm passionate in the fields of mechatronics and electronics. Well, the sources where I've been searching information are American Art Therapy Association, Houston University Online, Cleveland Clinic, Ohio University, U.S. Bureau of Labor Statistics, and Career Explorer. Um, that will be all for today's exposition. Have a great day and bye bye.